Today we're going to talk about a microbe called rubella virus. So, what is rubella? Well, the microbe rubella belongs to the category of viruses. It is commonly known as German measles and it is a disease caused by rubella virus. It is an infection in a highly contagious microbe caused by the rubella virus, which is usually transmitted by droplets of moisture from the nose or throat and mostly affects the skin and the lymph nodes. Where is rubella's habitat and what does it look like? Rubella comes from individuals who spread the disease from person to person. Both hot and cold temperatures result in decreases in the incidence of rubella, and low relative humidity is a risk factor of rubella mortality. Since rubella is weak resistant when exposed to external environment, this means that individuals who spend most of their free time no, rather, most of their times outside, especially with hot, humid environment, would most likely be prone to rubella. This is rubella's strategy to be able to survive and multiply and expand their habitats. When an individual is infected by this microbe, symptoms like mild illness and red pinkish rash is located behind their ears, around their neck, back, chest, legs, and stomach is visible, are visible rather. Other secondary symptoms can be swollen and sensitive lymph nodes. However, these symptoms are not visible until 7 days after you have been infected with rubella. So this is an example of a baby with rubella. There is red and pinkish rash around the face, including the neck, cheeks, back, and behind the ears. How and who does rubella attack? Rubella virus is spread by respiratory droplets, specifically sneezing and coughing, and when one individual inhales the virus. It infects in the upper respiratory tract, which results in rubella multiplying and spreading its region across the human system. This microbe usually affects babies, children, teenagers, young adults, including pregnant women. When a pregnant woman is diagnosed with rubella, risks are high and most likely it will affect the baby. Miscarriages and birth defects can occur, and in unborn babies, hearing loss and brain damage most likely will happen. The advantages of rubella. Once rubella is treated to an individual, it immunizes the individual against 3 potentially fatal diseases, specifically mumps, measles, and rubella, which is an advantage, especially if you're a woman, because when you get pregnant, risk of you having rubella would be low. Vaccines also is an advantage in this part because vaccines last for over 20 years. On the other hand, there is also the disadvantages. As it is highly contagious, pregnant women may be prone to this microbe which affects the baby in the womb and may affect the population when not treated. Side effects of the vaccination can also be a part of the disadvantages of rubella, as sometimes it may cause irritation, itchiness, and mild fever in some occasions, specifically to children. This is the advantages and disadvantages to the social and economic system. Advantages in the economics can also be portrayed as there will be a decreasing number of people diagnosed with rubella, which prevents the contagious disease from spreading and infecting more individuals. In pregnancy, for the disadvantages, in pregnancy, particularly the first trimester, rubella virus is far more dangerous and often leads to abortion, fetal death, and congenital rubella syndrome, which affects which affects about 110,000 infants just in low income countries itself. Congenital fees also takes part, as this also costs a lot, which affect people, especially in low income countries, with those people who cannot afford to treat physical abnormalities. Physical, including mental abnormalities. In social, it's prohibited to go near someone with rubella positive, as it is highly contagious and communicating with them is also not allowed because rubella travels by air and when inhaled, you may also be infected by it as well. So that is the end of my presentation about this microbe called rubella. And these are my sources.